findings, and you find you have the living patient to show that they are still alive after the medical profession has given them up. And yet they refuse to admit that it is a cure.
Nothing from nature, regardless of how effective it might be, will ever be proven safe or effective according to the FDA. It'll never be.
After she recovered from the breakdown, Renee started again from scratch, brewing the herbal mixture and curing patients in her own basement.
I have to grind them. I used to get them already ground wholesale, but I can't get it now, so I had to buy a grinder and grind myself.
At some point, she received an invitation to scientifically test her herbal remedy from a clinic in Massachusetts.
After supervised clinical testing in Toronto and Chicago, Ren consented, with feelings of redundancy, to further test in Boston. She worked alongside 18 doctors, one of them being Dr. Charles Brush.
Dr. Brush was the head of one of the most prestigious clinics in the United States, the Brush Medical Center in Cambridge, Massachusetts. He was also President Kennedy's personal physician and close friend.
Dr. McClure, an outstanding researcher and internist, gastroenterologist, undertook to study the effects of a drug or an herb called Asiac. This herb had been brought down here from Canada by Miss Case, who had showed documentary evidence that it had helped many, many people. Our work here, we showed and we found to our benefits and to the benefit of the individual that it was non-toxic and did have effects in help in the treatment of cancer. And as a result
At that point, Dr. Brush recommended Asiac to be tested for toxicity in order to be approved by the FDA as a possible cure for cancer. But once the herbs were turned over to Sloan Kettering, one of the most prominent pharmaceutical organizations in the country, the process got somehow bogged down by inexplicable delays and detours, and eventually never came to a conclusion.
The Sloan Kettering Institute in New York is one of the foremost cancer centers in the United States. The vice president and associate director is Dr. Chester Stock.
The results that I reported to Ren Caisse were studies in sarcoma 180 in the mice, in which we were looking not only for possible primary inhibition of the tumor, which did not occur, but also for regressions. And there was a very small percentage in a small group of regressions, but we never had the opportunity to confirm this and to see whether we could obtain better results.
Nevertheless, Asiac was never approved by the FDA, exactly as predicted by Dr. Leonardo 30 years before. Further attempts to legalize the cure were made by different groups of patients who went as far as suing medical authorities for denying them a possible cure for cancer.
They're asking to be given the right to use Asiac since orthodox medicine no longer has any answers for them.
You can't burn a cancer out of a body with radiation. You can't poison it out of the body without poisoning the body as well. And I feel that nature holds the answer, the only answer for cancer patients, and as such, we should have it. Our constitutional rights at the moment are being denied to us, and it shouldn't even come down to a court hearing. It should be a matter of fact that we have what we want for our body.
I have cancer from head to toe to the bone. You're going to try and tell me that if I think there's something that's going to give me a little bit of life, that I'm not going to try it?
But the response from the medical authorities was invariably the same, even if sometimes they were forced to come up with some truly preposterous excuses in order to deny its validity.
If we release Laetrile and Asiac and Crobizin and so on, I can give you a very long list. You'll have a very wide choice. Then when there is something effective, how will you know which to choose from?
In fact, someone thought better to prevent the medicine from being ever used by doctors who may eventually respond to a higher call of their conscience.
As it's well known in the state of California, the state legislature actually made it a felony for a doctor to use any than the accepted methods of treatment for cancer, and they named them in the legislation: surgery, chemotherapy, radiation, and cobalt. And when doctors are hemmed in like this, and their very livelihood is threatened, they're not going to be anxious to step out of line.
Exhausted by all these frustrating fights, one day Renee simply returned home and kept on treating patients on a personal basis until the day she died, in 1978. 1 year before that, many of her cured patients convened to her birthday party to thank her for what she had done for all of them.
Ex-patients and supporters arrived in Bracebridge, Ontario. They came to help Ren celebrate her 90th birthday. They have experienced the benefits of ESIAC. Many of the people here feel they owe their life to Ren.
Brought the two ladies up to you that day in the house.
She doesn't coffee.
I have given my life for it. I couldn't give any more than that. God's been good to let me live this long, to see it used. And used by people.